Hi, I'm Patrick.
And I'm Liv.
And this is the Mach-E vlog, but today is not about Mach-E's, it's not about EVs, but I hope you will stay tuned and watch this video and find out why.
So let's go.
First of all, we know it's beautiful behind us, but I think there's a lot of ocean noise that might interfere with the video, so we're gonna move to a quieter spot before we really get started.
That is a little better. We're actually just on the other side. The ocean's right over there. There is Blucifer, Tucifer, of course. And there's a big gap between us because that's where the seating is.
The seating bench is like missing right there, but that's all good.
All right, look, so I ended up in hospital. I guess that's how we could kick it off. Yeah.
Last week at this time, she was in the hospital.
Yeah.
If you've been watching our videos, you know that I think in our last road trip video that I just published, this goes back to like October, where she was having leg pain issues and
we should go back further. I am an amputee.
Oh, yeah.
We weren't actually going to make this video, but if you know Kyle Connor with Out of Spec, we were telling him about the ordeal. We just saw him yesterday and he was like, I feel like you should share this with everyone. So we're sharing it with you guys. It's all personal. It's got nothing to do with the car. So if that's not your jam, don't blame you. See you later. We'll see you in the next car video. This is all like a whole bunch of personal stuff. If you want to hear a whole bunch of personal stuff, then we want to share it with you guys because it's our lives and we're very open. We share all the stuff and it sort of impacted how we were making content because we were cranking stuff out for a little bit.
Yeah, we were doing like 4 videos a week and then we dropped and we barely got out one video. In fact, though, the one we got home from the emergency room at 3 a.m. and then I had to finish the video and get it uploaded by like 7 a.m., whatever. Yeah,
it's been a bit crazy, but we'll start. I'm an amputee. I've been an amputee since I was 16. It's a whole thing. I've been having a lot of trouble with my remaining limb. I call it my stump, and some amputees don't call that. Some amputees call it a residual limb or something else. You don't assume, ask what they call it. I call it my stump. And I had to be in a wheelchair a lot to try heal it. And the end of our road trip video, which Patrick was just finishing, I was actually picking up a test leg, which did not work. It was very, very bad, catastrophically bad. So when we finally moved to California, I was going to spend a couple weeks in the wheelchair to heal
her residual
limb, my stump.
Which she did.
Yeah.
So it was like you know, she started going through that. And off and on, like for the next month and a half, like we've had other issues with, we actually had COVID over
for the first time.
Christmas. And she had a sinus infection, but you know, so it was like all of this stuff. And then a week and a half ago, it was Monday, she started like, I feel like I have the flu. I feel like I have body aches. Can we go to bed early? And then we went to bed early and then she tossed and turned and kept me up the whole night. And you know how it is? It's like that first night, you're just like, oh God, I wish you would stop tossing and turning. But then it was like, at a certain point, it was like, something's not right here.
But I thought it was just flu again. I was really bummed out because it's like, we just had COVID. I just had a sinus infection for 2 weeks. Haven't been sick in 2 years. It's like, all right, maybe everything's just built up and we're getting rid of it in one go. Thought I had flu again. And then my leg started hurting a lot. And when I say leg, I mean my real leg, my human leg, the remaining leg, which is not in great shape. It was very damaged in the injuries it's a bombing. A bombing caused these injuries. So it was very damaged. But that leg started hurting a lot. And I just thought like maybe I pulled it when I was rolling around at night.
Yeah, because we are doing remote work from home. So we did our normal day jobs and we were just working. And she was like, I'm still not feeling great. But, you know, you attribute part of that is like she didn't get a good night's sleep and we were tossing and turning. And I'm like, yeah, I get you. And then you decided to...
I went and lay down.
Which is very unusual.
Yeah, super unusual. I think I took my lunch break at the end of the day and just went and lay down in bed. And I think after like 2 hours, I looked and my leg that was hurting was red. Like it had a big red rash.
Yeah, it was basically like a big red patch. Now, it wasn't like the whole leg was red. It was like a big red patch and was, well, we didn't notice inflammation, but we just saw that it was red.
It did look a little raised. And I thought that this was a blood clot thing or something. I don't know. Like, I think I'd heard
We didn't really
clot.
know.
Yeah.
But she's like, do you think we should go to urgent care? And part of that is like we just moved, so we didn't have like a doctor.
We don't have a doctor. And we've had COVID and sinus infection. Probably should have gone to a doctor. But like all the things that got in the way of us going to do all those things.
But then we went to the first urgent care at about 5. And they said, well, we're a small urgent care. You need to go to a bigger urgent care. So we went to their recommended bigger urgent care. And we like
They took my money.
Took her money. Took our money. Before we could even get into a room, really, they were like, this is either a blood clot or an infection. Either way, you need to get to the emergency room.
Immediately.
Yeah.
Yeah.
Because it was like, I wouldn't walk around. I wouldn't go home. I would go to the emergency room.
And by the way, I'm sure, well, I imagine you guys have had this too. You know, like feeling like you're blowing something up. Or like, should I go to the doctor? Should I go to the urgent care, the emergency room? Like, I don't want to make a big thing. It's probably fine. I'm being a hypochondriac. So I totally had all of those things. And I'm glad I went. So we were at the urgent care and the person there literally said, you need to get to the ER immediately. Immediately.
And then
it was very scary.
He recommended an ER about 15 minutes away. So we're driving over there. And then I noticed like you could tell the pain was getting worse because we'd hit bumps and like, oh, and I was like, what, are you okay? And
it wasn't pain in the leg, so to speak. That was painful. But like I was getting muscle aches and body aches. Like the flu feeling was intensifying and so my whole body was hurting very quickly.
Because we got to the emergency room and of course they had like a patient drop-off area and I was literally worried about like, can she get in the door?
Which I could not, but there were nice people that had a wheelchair that they put me in.
Yeah, so she was getting out and I saw them coming over, so I'm like, quickly parked the car. We went in and it's an emergency room, so it's hurry up and wait.
Yeah. But I mean, okay, look, there were people, I'm sure, with very urgent things, but like I thought because the urgent care guy was like, get there immediately and blood clot, and he said those words, I thought that would be important or like, an urgent thing. But it took many hours during which we just sat there and I sat in the wheelchair and the pain got very bad. Which I fortunately don't remember very much, so Patrick remembers it. Sorry.
No, it was actually, it's very hard to see because like Liv deals with a lot of pain and you guys don't see it. Are you?
Yeah, I'm sad that you hurt watching me hurt.
Well, you guys don't see it in the videos, but there are often times when it's like we stop filming and then she's like, I got to sit down. My leg is killing me. So when she says like, I'm in pain, like I know she's in pain and it brings back memories of seeing how painful it got because it went from like, I'm not comfortable and she was shifting around and was like trying to get a comfortable spot. And then it just got worse and worse and was literally, her eyes were leaking. She was crying and started shaking. And I'm like, we got to do something. And they were doing stuff like, we got to take you back. We do triage. And then it's like, okay, yes. And then they bring her back out. And then it's like, okay, we got to take you for your blood work. And then they bring her back out. So it was like they were doing stuff, but it was just taking like a really long time. And then they finally were like, okay, we'll get you in the back and we got to get you some painkillers. We're going to get you, I think, Tylenol.
Did they?
Yeah, they started with just Tylenol.
And at which point I think I was moaning nonstop.
They gave her that and then they're like still running around or waiting. And they were...
I have to pull my note.
Checking on her. And they would come in and like, okay, we need to do blah, blah, blah. Can you verify your name and birthday? And she was like, what? And I was answering for her, and they're like, she needs to answer. I'm like, she can't answer. She's in too much pain. So they finally are like, okay, let me get with the doctor and we'll get you some better pain meds. So they gave her Norco, which is a bit stronger.
A lot stronger. It's a Tylenol-based narcotic or something.
Yeah.
And that was like 4 hours later after we got there. Yeah.
So the timeline was 5 o'clock, first urgent care, 6:30 or so, got to the emergency room, finally got into a room at the emergency room, like, we're going to do something at like 10, and they started giving her pain meds, which weren't really helping. They had to do an ultrasound. I'll skip over some details, like they did an ultrasound, which was extremely painful, and then...
But I was so excited that they were doing the ultrasound, because that was the thing that would tell if it was a blood clot. And in my mind, I had a blood clot, and it was creeping up my thigh, because my whole body was aching, and my leg was in terrible pain, and it was creeping up my thigh, and you could see the redness on my thigh. So I was like, this blood clot's gonna kill me right now. So when they did the ultrasound, I was screaming, but I was also really happy.
Yeah.
But
they didn't find a blood clot, and they started going like, yeah, it's cellulitis. We know how to treat this. It's going to be okay. You just have to do drip IV antibiotics, and then just keep doing antibiotics. You're going to be fine, and we'll give you a prescription for the Norco. That'll make the pain go away. And the pain.
Was this when the orthopedic surgeon came in though?
Oh, that wasn't the first time.
That wasn't the first time. Okay. Yeah, it was chill. Cellulitis is a bacterial skin infection. Just to jump in.
Yeah.
You have bacteria on your skin. It's not like you were introduced to weird bacteria. It's like there's bacteria on your skin all the time. And then somehow, through a cut, a scrape, a crack from dry skin or whatever, that bacteria gets in your skin and goes rampant. So that's what happened with me. However, I didn't have a cut or scrape or anything, but my leg is very damaged anyways. So, but it was very unexpected and very like weird. Like normally there's a site of trauma that people like, I got a dog scratch, or, you know, I bumped my leg on the doorway and then it went crazy.
But we felt pretty good. Like, she was feeling better. They were getting the pain down, but she was still in a lot of pain, because I remember driving home and it was like, good grief. Like, you don't notice how many little bumps and cracks there are in the road until your partner is...
Even with MagnaRide.
Yeah. So we made it home. Do you remember we almost hit a coyote on the way home?
No. Oh. Yeah.
Yeah, right before we got to the neighborhood.
Oh,
the coyote
you were
darted
really
out.
excited about it, and I was like, okay, whatever.
I was, because I literally slammed on the brakes. But
I think I was focused on that.
But we got home. She went to sleep. We only got like 3 hours of sleep, but my alarm went off, and we're like, well, I guess we could do some work.
Well, I mean, so fortunate to be able to work remotely. Sorry, I'm trying to adjust my mic quickly.
That's making a lot of noise, so let's wait a second.
Oh wait, let me put it on the other shirt. There. Good?
Yeah.
So grateful to be able to work from home, because even though both of us spent the whole night in the emergency room, I just worked in bed. And that's truly, truly something I feel so grateful for, and I wish everyone had the opportunity to do that.
Yeah. And so that was
That was Tuesday.
Yeah.
No, sorry. So Monday, everything started. Tuesday, we go to the emergency room. Wednesday, back home, we even stopped and picked up all my medicines. I was on 2 antibiotics, and this was in the middle of the night, Tuesday night. So starting off Wednesday, I'm on 2 different antibiotics. I'm on painkillers, thinking we're doing the right thing. I'm working with a pillow, so my leg is up and everything. They're okay. Okay. Yeah. It was not okay.
Yeah, so Thursday, she's like, we thought, because like every time I've done antibiotics, I've been like, things just all of a sudden like magically get better. Like I've had an ear infection, and then it's like, take antibiotics and it's great. And everybody's like, no, you still got to take all the rest because that's how you treat it. Well, it wasn't getting better. And then on...
It was getting worse.
Thursday, it's like, I think it's getting worse. And the swelling was getting worse. And we're like, okay.
My leg looked like a lobster.
And
I just remember boiled lobster.
Of course, they tell us, if you notice things getting worse or you fever, like typical little signs, fever, chills, anything like that. If you notice that, come back or go see your GP. Again,
Which we don't
have one.
Yeah.
So we Liv made an appointment with the clinic right down the street that's associated with the emergency room.
And did 10 in the morning, I took time off work. I was like, guys, gotta go. Thought we were doing the right thing. Made an appointment at the clinic, thinking we're being all proactive, right? Because the emergency room said you can go to one of our clinics and everything.
But we got to the parking lot, and the clinic calls and says, "You're coming here for what?" Like, no. You need to go back to the emergency room. So we're half annoyed, but half like, is this more serious than we are expecting? And of course, we're in America, so we're of course thinking like, oh no, this is another big bill, another big medical thing. Who knows how much is covered?
I'm terrified.
But we got back to the emergency room at about 11, I think.
11 in the morning. And I do want to preface this, by the way. So, I know amputees who have become amputees from stuff like this, just sudden things like this that happen, blood clots, bacterial skin infections, stuff like that. So I was really, really terrified of something happening to my other leg. My other leg is a mess. It's all scarred and all that, but I love it. It's amazing to have a human leg. It's the best thing. It's really useful. I don't want to lose it. So I was terrified the whole time of losing my leg. And at one point, one of the doctors was like, well, maybe it was because you were in the wheelchair so much that it created a blood clot. So, and obviously they said no blood clot and everything, but the entire time I'm thinking, oh my God, I've messed up my real leg. Yeah. It's terrible. I'm going to lose my leg or something.
But we got back to the emergency room and we're like, how does this work? They said we could come in for a follow-up. Well, the way it works is you wait through the whole process again where they have to triage and do blood work and all this other stuff. But this time I noticed they got us back to an ER room. And as soon as they got us to an ER room, the physician's assistant, which is what they do now, they don't send a real doctor back. Not against physician's assistants, but we noticed the physician's assistant immediately is transferred it over to a doctor. And then the doctor was like, we're going to admit you.
But that doctor was an orthopedic surgeon. Wasn't that? When did the orthopedic surgeon come in?
That was later.
Oh, God. We were there a lot.
Yeah.
Okay. Oh, the doctor.
Yeah.
Shout out to this doctor, David Lowe.
Mm-hmm.
David?
Daniel Lowe.
Daniel. God. Okay, look, I was high. I was a big old baby. Sometimes people have thought that because I spent a lot of time in hospital or have had things like that I'm used to this stuff. No, I have hospital trauma. My family has hospital trauma. I told him that right then, and he helped through the whole process. So to doctors who take the time to care for people who are big babies like me or just, need a little more
She was dealing with everything so great.
You're sweet.
And it was...
Thank you. Thank you very much for taking that time and effort. And
it was a...
bedside manner.
Ordeal, but we felt like, okay, don't want you to be admitted to the hospital, but thank you. They're going to take care of all of this.
Yeah.
But then another hurdle, I guess, was I think we mentioned that we had COVID back in December.
Yeah. End of December, Christmas time.
Apparently that caused one of the 3 tests that Liv took.
The first one.
To come back positive for COVID.
The first night they're like, oh, by the way, you're COVID positive. I was like, oh my God, I just had COVID. We haven't been around anyone because I've been in a wheelchair and staying at home. So it was a big shock. When we got home that first day, we both tested. We were both negative.
And then when we went back to the ER, they tested. And then a day later in the hospital, they tested it again. Negative. But why that was a big deal was we're going to admit you, but we're going to put you in the COVID ward. And we're like, wait, what? And then it was like, but we had a positive and then a negative. And they're like, I know, but it's protocol. There's nothing that we can do. And it's nothing that we could do. But that sort of added an additional layer of panic.
Yeah.
One, because it's like, we think she's negative and she's going into a COVID area, but then also different visitation rules.
And the way that they said it at the time, they were like, you're going into the COVID ward, no visitors are allowed. And I'd already had some difficulty with wanting Patrick to be there. One, because he's an amazing emotional support. He knows everything I've been through, but also I'm partially deaf in my right ear. Everyone was wearing masks. There's a lot of noise going on. People were asking me things or saying things or calling out my name, and I couldn't always hear it, even when I was coherent.
Yeah.
So all of a sudden now, you're gone.
Yeah.
I can't, like my translator,
So that was like, no. And then, long story short, we're making this one really long. But anyways.
Long story longer.
They were like, it's okay while you're here at the ER room, but when we transfer you upstairs, he can't visit. A couple of things. One, we were sort of like, well, just stay down here as long as possible. Mm-hmm. Two, they'd actually changed the rules like a week before, so it wasn't as bad as we thought, but...
I was very emotional and suddenly felt bereft and alone. And
yeah. So when they finally did get her a room, like I said, we went in at like 10:30. She finally got a room at like 7:01, which visiting hours were over at 7. So we're like, ugh. So it was really sort of traumatic because it was like, roll her upstairs. The lady that was part of the transport team was like, you can come with me so you know where to go. And then when we got to the door, it was, you can't go in and buy. So it was a hard night. And
I mean, my heart goes out to anyone who had to deal with severe medical issues. I'm trying to fix my leg. During the time of COVID, or deal with COVID and being in the hospital, because I only got a small taste of that, and it's really, really awful to be at your worst moments all alone. And
it was, so like during this process too of that night, that's when they brought in an orthopedic surgeon. They were like, we need to do a CAT scan of the leg to make sure the infection isn't going deeper. We need to bring in an infectious disease person. So it was like they were introducing a lot of scary things.
And the orthopedic surgeon, the reason I keep saying him is because he came in and he said, it's probably cellulitis. It's probably not necrotizing fasciitis, which was the thing that has terrified me because I know amputees from that. And I'm very attached to my leg. All right, So he said, I know he said it's probably not, but he said the word probably. And this not responding to antibiotics, I was terrified. And my leg was this big lobster and the drugs weren't working. What is happening?
And one of the things that we learned is that like when your body is fighting infection, you can get lymphatic streaking.
Yeah.
Which is basically like, she was getting this like red streak up her thigh, which looks scary as heck to us.
Yeah.
But what it is your lymph nodes are like doing its job to fight the infection, but it creates swelling and inflammation and redness. So it looked terrifying. Things are moving. So it was all worrisome, but they admitted her. I had to leave immediately, didn't know when I could come back. They fixed the rules the next day and said, you can come back, but for only 2 hours at a time, 2 hours per day.
2 hours per day, yeah. And you only allow one person at a time. So my dad actually ended up coming at one point, and then Patrick traded off. But okay, so the first night when I was admitted, at one point my pulse was 120 and my blood pressure was 90 over 60,
which normally it's normal and both.
Yes. No, normally I have normal blood pressure and a normal heart rate. So this was obviously like my body responding to the infection. And Patrick says it was very scary.
I knew those are things they were watching, and like I knew they kept on setting off the alarms. And I was trying to get
that was so annoying.
her to calm down. And she knew it was high.
There. Yeah.
Yeah, she was literally like falling asleep. and her heart rate would go up above the alarm level into the 120s, and then they would come reset it, and it was just
It's
worrisome.
so weird because like I remember the alarm going off and I was like, I didn't know I was doing it. Just why is this thing beeping all the time? But okay, so that was really painful that first night. It was horribly painful because of the infection, like whole body ache, terrible, everything hurt. The next time, it's fine. It's so much better having that part cured. Like the antibiotics at least fixed that part. But I started to feel sick. Like I couldn't open my eyes much. I couldn't speak much. My head was throbbing. What else?
Just sensitive to everything.
She wouldn't move my head or
move her.
Yeah. And I thought that it was just like the stress and the
side effects
and the crappy pillows, whatever.
Yeah.
So I get pulled into the hospital. Everything's happening. They start treating the side effects. So the nausea, they start treating that. The headache, they treat that with narcotics. They start treating all this stuff. And it was only, how long was I there for?
Like 48 hours, really.
No.
Thursday, Friday, Saturday, I guess.
Yeah, 3 days.
72 hours.
Days. Yeah. So it was only like 3 days later that...
Yeah.
Yeah.
Maybe, oh God.
They realized it was a migraine. Like all of the bad effects were a migraine. Oh my gosh, if you're a migraine sufferer, I'm so sorry. I had no idea how terrible it could be. And I didn't technically have a history of migraines. I forgot that I get ocular migraines because they're not sore, they're just visual disturbances.
Yeah.
But that night, getting back in the hospital, I don't know what it was, but that's when this migraine started, maybe the narcotics. And then they kept treating the migraine or the things that it was doing, which was nausea, disorientation, pain.
Cycle, because it was like, give the antibiotics. Antibiotics cause nausea. Or it was like, I just know she kept on going cycling, and the nurse would go away and be like, now I need
a different drug.
A different thing.
Yeah.
Nausea, headache, and then by the time you were feeling better, then it was
So initially when I was doing the COVID timing, Patrick came to visit and I was in a bad cycle. So, but then the doctor had an idea, and there's a shot that you can get for migraines. And he was like, we'll give you this shot, and if it works, we know this is a migraine.
Well, he said it responds to migraine medicine. So, so anyways, it was, I still remember, it was like they gave her the shot at like 2:40, and then she sort of like dozed off, and at 2:51 she goes, oh my gosh, it's gone.
And then I fell asleep.
And then fell asleep for the next like 3 hours of visiting hours.
Yeah.
But it was that was Saturday. That was when everything was sort of feeling really good, because you could see that the infection was actually finally receding a little bit. It wasn't so swollen. The nausea was, and the headache was gone with that. So it was like, things are looking really good. And that was sort of like the miracle, great moment of everything, the turning point, when I finally, I think, could like breathe a sigh of relief and was like, okay, I think things are good. I think she can come home tomorrow. And like, when I got there on Sunday morning, like you could just tell, like she's like, I had breakfast, and it was really good. But she's still doing the antibiotics now. I think they stop tomorrow, right?
They stop tomorrow. So this is a week later now. Tomorrow is a week since I got let out of the hospital. I've spent most of the week working in bed with my leg up. I tried to work in a chair, but my leg turned purple. If there are any doctors in the crowd, if anyone's still watching, I welcome your input. It seems like it's definitely cellulitis, but I have really reduced circulation due to all the injuries. But I tried to work in a chair with my leg up, and it turned a little purple. So I spent most of the week working in bed with my leg up. And the scary part is that it's not responding in the same way to the antibiotics. Like in the hospital, I was getting these 2 huge syringes full 3 times a day. Mm-hmm. And you could see my leg. Every time I get the shots, it would go like, loop, and change a bit.
A little bit.
Yeah.
Not as fast as that.
Sorry, I have to blow my nose.
There's still quite a bit of red pinkness now. It's not red, but it's getting, I mean, it is definitely getting better, but we were sort of hoping it would be better a lot quicker. If you have any experience with this, or if you're a doctor out there, let us know, like give us tips of like what we can do to continue to help improve. That's why we've been sort of taking it easy this whole week. And then like today we did a drive just because we got a little bit of cabin fever. And
it was so nice.
Yeah.
It was so nice just to be able to sit in a comfy car. By the way, car thing, the second time getting into the car from the hospital, it's so comfortable. The Mach-E
So this is about the Mach-E.
It's about the Mach-E. So comfortable. Magna Ride has been really nice.
Yeah.
Because I was sensitive to all bumps.
Yeah. So I know this is a super long video. Do we have?
It's a super long video, and I haven't mentioned it on social media or anything, the experience, because I've been scared that it would go rampant again, because it didn't respond to antibiotics, and I didn't know how to process that and that fear.
And I let a few, family know, and then like a couple of close friends, like one friend that we know that's a nurse, mainly because I felt like, first of all, family, of course they have to know, but I wanted to limit how many people knew, mostly because I couldn't deal with anything else. Like it was hard enough keeping family informed, and we love well wishes and whatnot, but it can be very difficult when phone is going crazy. And moms and dads and sisters have a lot of questions, and rightfully so. So I was trying to keep them all up to date with every little detail, and especially with what your family went through.
Yeah. So it feels like this is very dramatic, right? It was just a bacterial infection. I still have it. It still hurts, all that. But it's like, I went to the hospital and I was on an IV and everything. And it's like, that's fine, right? That's not bad. It's good. It's not an expense that we were prepared for, and I'm really scared about that. But like, didn't have to have surgery. Everything's okay. But
it feels, in retrospect, it feels minor.
Yeah.
Like, and like when I tell people, it's like, she had a skin infection, went to the hospital, now we're good. But it was,
although not good because it's not healed. But
but it was 3 or 4 days of not knowing exactly if we were on the right track, and then like having orthopedic surgeons come in and doing CAT scans to see like if it's deeper or whatever. It was all very scary. And then like we've looked up stuff since then, and we're like, high heart rate, low blood pressure could be a sign of sepsis, which is extremely dangerous. And I'm like, thank God nobody said that. But and then just watching the pain and stuff, felt traumatic to us. So that's why we're sharing.
And sweet dogs going by. And all of that is to say, I know we haven't really talked about it in depth, but my family and I have hospital trauma, have injury trauma. I was in the hospital for 7 weeks and spent a year and a half recovering to a point of vague function when I was a teenager, when I was 16. So I have trauma around that stuff. My family does, and now Patrick does too. So we were cranking out videos because we were like, I get to spend time in a wheelchair. I'm finally in a house that's wheelchair accessible, and we were really like just having a great time and feeling like we're being productive. Even when we had COVID, it's like, all right, cool, this is good timing to have COVID. And so that's what happened, and that's why we stopped making videos for a little bit. Maybe you guys didn't even notice, but
I had a couple. Well, one almost done, and then I finished another the one day when she slept the whole day in the hospital. So I got like 90% of it done that day. So we didn't miss our one per week, but we were cranking 4 or 5 per week. And if you include Evie Explored, we had
trying
extras.
To do stuff for that too. And obviously our day jobs, like the first hospital stay, the whole thing was I missed Friday and then was back at work on Monday.
We had some long lunch breaks and
but most of it was over a weekend, and then we got back to our day jobs.
We should let them go about their lives. And I'm also hungry. So.
Are you?
Uh-huh.
Okay, by the way, we did a ChatGPT picks our day trip adventure today, and it picked a really great trip. We had a great time. I think
we'll do this video first, so look for that video.
Yeah, look for that video. It'll be fun and car stuff.
It'll be something like ChatGPT chooses our day trip or day adventure, an adventure day, or
something like that. Anyways, so this is where we ended, and now we're gonna go take my dad out for dinner. He lives right up the road. But anyways, we just wanted to share that with you. I don't know. It feels really weird sharing that stuff here, doesn't it?
It does, but
yeah.
If you guys all give it a thumbs down, or we get like 20 views, we won't ever do this again.
This is not. It's not really for views, though.
No, I know.
Yeah, this is like okay. I have to say a little more. Okay.
Okay.
We didn't know that anyone would watch these videos when we started making them, the car videos at all. So we so appreciate you guys joining us for the car stuff, for the adventure and everything. And it feels very personal because we try to be really authentic and just genuine, because that matters. It matters to us. So that's why we're sharing this. It's really weird. We probably won't do it that much. But okay, look. Health stuff is scary. Your health stuff has probably been scary too. I'm sure you have scary times in your life, or maybe you're going through that right now. So if you want a space to share and a safe space, I welcome you, encourage you, or hope you feel okay with, I'm sorry, I got emotional. With sharing that here. And if anyone's mean to you, don't be mean to anyone. We'll delete that comment. But we can support you too, because that's what it's about. Okay, now we can go. I got to a car sign. It's not car stuff.
I was trying to think in my head, like what she was saying. Just remember
that whatever you drive
or whatever you're suffering from.
Enjoy the ride. Bye.
Bye.